Hi, welcome to the Vet School. My name's Dr. Lindsay Bishop and I'm going to help you find out a little bit more about what it's like to study veterinary science here at Bristol. For our 5-year BVSC, the teaching is split across the two campuses, Clifton and Langford, in years 1 and 3. These are approximately 14 miles apart. The majority of our students choose to live in the city centre for these years 1 to 3, but there is free coach transport which is provided between the campuses in these years, so students don't necessarily need to own their own cars. In year 4 and 5, the majority of students choose to live in Langford and the surrounding area. In year 5, our students are on rotation, which includes being on call at certain times. As such, they need to live within close proximity of the vet school. Here you can see a summary of our curriculum. It's based on our famous local landmark, the Clifton Suspension Bridge. And as you go across the bridge, you can see the first part of the course focuses on the healthy animal before we consider the ways in which disease can affect animals, and then moving on to learning how to prevent, diagnose and treat illness. The curriculum is underpinned by some themes that run throughout the programme. We support students throughout the course to develop their professional and practical skills and how to understand and contribute to research. We use case material right from the beginning of the first year to help students develop clinical reasoning and understand the clinical context of their learning. As a school, we have an international reputation in animal welfare research and public health teaching, and these also underpin everything we do. A competent veterinary professional needs to have a good understanding of the underpinning science. For example, you can't perform surgery without a good understanding of anatomy, so therefore, learning what is normal allows you to understand what is abnormal. Understanding normal physiology and biochemistry are key to be able to understand disease states, diagnosis and therapeutics. All of year 1 and part of year 2 are spent learning about these aspects within the animal health science units. These also instill understanding of scientific thinking, methodology and processes, which are key skills for the veterinary health professionals. Having gained a good understanding of these foundations, our students start to learn about the paraclinical sciences in the animal disease units, which include those agents that cause disease, why disease occurs and what it looks like at a tissue level, and the background of how medicine works. Starting in year 3 and continuing to year 4, students then apply the knowledge that they have built up so far and start to learn the clinical sciences in the clinical veterinary science units, which includes medicine, surgery, diagnostics and therapeutics. Most of the theoretical teaching is complete by the end of year 4, which is a short year finishing after 2 terms. Currently, once the students come back from the Easter vacation in their 4th year, they complete a short unit called Classrooms to Clinics, which prepares them for clinical rotations, and then it's straight into the extended clinical final year. At present, our final year comprises of core rotations until mid-spring, followed by a student choice track rotation, 2 weeks of veterinary public health and professional studies, and then student elective. As well as learning the pre, para and clinical sciences, the entire 5 years of the programme is underpinned by these vertical themes. So here are all the 5 vertical themes that run throughout all 5 years of the programme. Evidence-based veterinary medicine and veterinary public health are referenced within a number of the taught units each year, whereas professional studies is a standalone unit. So the vertical themes, animal management and practical and clinical skills, form an important part of the programme. In years 1 and 2, the emphasis is on practical animal management. You'll be taught how to handle the species of animals you're most likely to come across in practice. This includes cow, sheep, horses, dogs, cats and rabbits. And it provides a solid foundation for developing your clinical skills in years 3 and 4. So year 5 is very much about practical clinical skills, and students are working very much as apprentice vets on their clinical rotations. We use a combination of models and live animals, allowing you to practice your skills in a safe environment for both yourself and the animals, but also giving you the exposure you need to work with live animals. Our students are taught clinical skills in our Clinical Skills Laboratory, or CSL for short. This is a vital resource for our teaching, and all our students have the opportunity to work with many innovative animal models. As I already said, our students do also do practical classes with real animals, but the CSL is a vital tool for teaching students clinical skills in a safe learning environment. It is recognised as a world's leading skills lab, with our teaching staff contributing to the development of other labs internationally. To develop their clinical and practical skills, all students undertake work experience in the form of extramural studies, or EMS for short, which is a mandatory requirement for all vet students wherever they study in the UK. EMS placements allow students to consolidate their practical animal handling skills in years 1 and 2 and their clinical skills in years 3 to 5. At Bristol, we have a dedicated EMS team who will work with our students and placement providers. The first EMS placement is at Easter, and the team place all the students in the lambing placements. All other EMS is organised by the students directly with the placement providers. We have a very large directory of EMS placement providers, and students can provide feedback on these providers, so the years below can have a look at the feedback and choose for themselves. We are very happy to accommodate students who want to find placements outside of our lists, and we do need to check the provider to ensure it's suitable. While the preclinical EMS experience tends to be very similar with the lambing, students can really make a bespoke package for themselves when thinking about clinical EMS. They can choose areas of practice that interest them most or try out areas that are unfamiliar to them. There's a summer research studentships can count towards the clinical EMS, and it is possible to do at least some of your EMS out of the UK. So let's have a look at another one of our vertical themes, professional studies. Professional studies is a standalone unit with 5 elements. It includes communication skills, professional conduct, ethics and law, business management, health and safety, study, learning, investigation and employability. It includes pretty much everything that is not science, medicine or surgery, and teaching on these 5 elements is delivered in almost every year. Some of the professional studies is there to help students get the most out of their veterinary programme, and some is to help students after they graduate, but much of what is taught is of value both as a student and once working in the veterinary industry. So let's take communication skills as an example. What is taught builds year on year. It includes both face-to-face and written communication. In year 1, students learn about the basics, and then this progresses year on year, so by the time they graduate, they'll be able to interact professionally with clients. But the theory was only going to take you so far. The best way to learn to communicate with clients is to actually do it. We use trained clients and specialist role players to allow students to work on their practical communication skills in a safe and controlled environment. By the time you enter your final year, our students should be competent and confident in their ability to perform solo consultations with the clients they will be seeing on their clinical rotations. So now let's have a look a little bit more detail at the first year. So what will year 1 look like? Well, how we deliver our courses will depend on the government guidance on social distancing at the time. We are preparing for all different scenarios in order to maintain the excellent teaching offered at Bristol. For units that are taught through small groups, e.g. lab practical classes, we will continue to teach in person while following the national safety guidelines in place at the time. So I give you an idea now of what our first year looks like at the moment. The first years we spend 4 days a week based in Bristol and 1 day out at Langford. A lot of the time in Bristol is spent in Southwell Street, which houses the anatomy centre and dissection rooms. They also do practical classes in the biomedical science buildings and maybe timetable for teaching in various buildings around the main campus. The 1 day at Langford is generally packed to make most of coming out to the clinical campus. At Langford, mornings are often timetabled for theoretical teaching and afternoons to practical classes. We are also currently have links with Cannington College, where we are lucky to have access to their resources, including a wide range of animals which students can get hands-on experience with. There's no teaching on Wednesday afternoon at the university, and you will have approximately 50% contact time in the first year. We would expect you to be working about 38 to 40 hours a week in total, including your timetable teaching. You're going to be hands-on with animals from early on in first year, doing animal management practical classes, as well as interacting with animals in the live anatomy barn at Southwell Street. You will find studying at the university is slightly different to school or college. There's no standard textbook that covers the year 1 vet curriculum. Instead, you'll be acquiring information from a number of sources, including lectures, practical classes and self-directed study. All lectures are recorded so you can revisit the lecture at any time for study and revision, and lecture PowerPoints are stored in our virtual learning environment, Blackboard. In Animal Health Sciences unit, you'll be using an online tool called eBiolabs. We're expected to engage with prior and after your practical classes. You'll be doing this pretty much every week. During the year, you'll be undertaking a number of what we call DSEs. This stands for Directed Self-Education. Some DSEs are individual tasks and others are group tasks. They all form part of the end-of-year assessment and are either must pass or accrue a mark. You're assessed in a variety of ways. Some of this will be by the DSE and some is by exams that are held at the end of each unit. You take a short unit called Animal Health Sciences Foundation for the first 6 weeks of the year 1 and take an exam at the end of this. Your other units will have exams in the summer exam period and may also have exams in January. You have to pass the overall unit assessment for each unit in year 1 before you can progress to year 2. So let's have a look at a current first year timetable. This is an example of 1 week. No 2 weeks are ever the same, but generally you'll be timetabled for about 50% of the week. We can't always provide practical class teaching for the whole year of 150 students at the same time, so we split the year into 10 groups of 15. This ensures that the students are able to get the most out of these valuable hands-on teaching experiences. You can see that on Monday afternoon, only groups 1 and 2 and 5 and 6 will be having the library database practical class. The other groups will be timetabled this in other weeks, but this week have nothing timetabled for Monday afternoon. On the Thursday afternoon, the various groups will all be doing different practical classes. By the end of the teaching block, all the students will have done all of the practical classes. It is essential that vets learn about the preclinical, paraclinical and clinical sciences, but there is much more to being a vet than this. You're doing a vocational degree and there is much more to the job than knowing about science. Hopefully, the last few slides have demonstrated how we prepare you for being a vet. On the clinical campus, we have Langford Vets. Students will see first opinion and referral practice in a real setting in a customer-focused, profitable business. We have first opinion practices for small animals, horses and farm animals. This includes our new acquisition of the Stables veterinary practice. We also have small animal and equine referral hospitals. In addition, we also have a diagnostic laboratory business offering the full range of diagnostics from genetic testing to post-mortem examinations. If you want to find out more about our clinics, please visit the Langford Vets website. We employ a large number of vets, vet nurses and other professional support staff on the Langford campus. Some vets work in clinics only and others combine clinical work with either teaching or research or even all three. Students on the extended final year spend a large proportion of the year working in our first opinion and referral clinics. We all know that just because you know how to do something, it doesn't mean you can teach it. The vet school has a strong commitment to developing the teaching skills of our staff. The university has a very good teaching programme and many of our staff continue to advance their teaching skills, as a result gain higher qualifications in teaching and are nominated for awards. For example, this year Alison Baxter, a first opinion vet with specific interests in teaching communication skills, is completing a university funded teaching associateship. Both our skills lab teams and the team developing the graduate entry programme have been awarded competitive university funding to support projects that will further enhance teaching. You may have heard of intercalation. This is open to students who are studying dentistry, medicine and vet sciences. You don't apply to this until your third year of your programme, and we give our students much more information closer to the time. This is in contrast to many other university programmes that you might have seen, where you would be applying to take a year out in industry or abroad when you first apply for your degree. Vets can intercalate after year 3 of the programme and will take a year out of the vet programme and spend the year doing your intercalated degree, which can be at Bristol or another UK university. Once this intercalation year is over, students return to year 4 of the vet programme. Many of our students intercalate in related science programmes like anatomy, biochemistry and physiology, and some intercalate in applied animal-related degrees such as Masters in Global Wildlife Health and Conservation. However, it is possible to intercalate in all sorts of degrees, including art degrees if you wish. At the vet school, we appreciate that life in our fast-paced, ever-connected, seemingly never-sleeping world is a challenge for everyone. Although the vet programme is intensive, we encourage our students to maintain a sensible work-life balance and think about their own health. While students might find it hard to maintain a very high level of extracurricular activity required to be a top sports person, there is certainly time to enjoy all the clubs and societies on offer within the university and the city. As a school, we felt that we should be specifically signposting staying healthy as part of our professional education, and for this reason we introduced wellbeing seminars into our curriculum a few years ago. Centaur's welfare section has trained students to act as wellbeing peer mentors across the preclinical and clinical years, and within every school, every student has a personal tutor who can provide pastoral support led by the preclinical and clinical senior tutors. We have faculty student advisors who can advise on a wide range of topics from housing and debt to mental ill health. And Amy, the vet school advisor, splits her time between Bristol and Langford. There is support for new first-year students in university residences. And we also have on-campus GPs in Bristol, counselling services and a service that supports our most vulnerable students. At Langford, our students use the local very good GP services and a visiting counsellor. So, what do our BVSC graduates do? The demand for vets far exceeds the supply in the UK. In fact, every year only half of the 2,000 new registrations with the Royal College of Veterinary Surgeons are the graduating final years from UK vet schools. The rest come mainly from the EU. Most of our graduates tend to go into practice initially. Some will stay in first opinion or referral practice for their entire careers, and others will move into other areas of the profession. Some of our graduates will go straight into postgraduate programs. We work on employability from early on in the programme, and as a consequence, many of our graduates already have a job by the time they graduate, and the rest find jobs very quickly after graduation. While most of our graduates stay in the UK for the entirety of their careers, you might like to know the options for working around the world. The Royal College of Veterinary Surgeons accredited degree is well respected, and many countries will accept this as a registrable degree. We already hold European, South African and Australian accreditation, and we're currently awaiting the accreditation from the American Veterinary Medical Association. This accreditation will set you on the path to practice veterinary medicine in the US and Canada. So I hope you've enjoyed my introduction to the vet school. If you've got any questions or queries, please don't hesitate to get in touch with myself or your student ambassador mentor. I hope you have a great week during this summer school, and I look forward to meeting you all at one of the live sessions. So stay safe, and I'll see you soon.